The anterior cruciate ligament, or the ACL as it's most commonly referred to, is the primary stabilizer of the knee. The knee consists of four main ligaments. Two ligaments that are outside the knee, the MCL and LCL, and then there's two ligaments inside the knee, which is the ACL and the PCL. And the ACL and PCL cross over each other, and the ACL's function is to stabilize the lower leg bone, or the tibia, from shifting or subluxing. And unfortunately, that patients that have a ACL rupture now have an unstable knee. The most common causes of ACL tears are usually associated with a pivoting or twisting type motion, or a rapid acceleration or deceleration of the knee with a twist. 70% of ACL tears occur with a non-contact injury. So it's not always that the football player gets hit, but the football player tries to cut and turn a different direction, and then the ACL ruptures. The most common symptoms of an ACL tear in the acute setting, right when it happens, is most often the athlete or patient will complain they felt a pop and they had immediate pain and swelling in the knee. Most of the time they're unable to continue their endeavor of or whatever sport they were playing at that time, and the knee is quite swollen. After a week or two, the swelling tends to subside and they are able to put weight on it and walk, but they'll complain that if they try to twist or cut, their knee will give away on them. And every time it gives away, it's doing a little more damage in the knee. The treatment options for ACL injuries are twofold. There's operative and non-operative. In the low demand patient that does not have frequent instability, we do some physical therapy and bracing. In a patient who wants to continue an active lifestyle and has instability of the knee, we usually recommend ACL reconstruction. Unfortunately, once the ACL is torn, it won't grow or heal itself. So we have to reconstruct it. We have several options that allows us to do that. With ACL reconstruction, we have to replace the native ACL that's torn with a graft. And there are three options that we use for ACL grafts. One is a patellar tendon graft, so we can take part of the tendon that attaches the kneecap to the tibia bone and use that as a new ACL. We take two of the three hamstrings that are on the side of the knee and rebuild a new ACL. And the other option is that we can use what we call allograft, which is a donor tissue graft, and reconstruct the ACL. After the surgery, the patient is able to put full weight bearing on the knee. We start physical therapy immediately. Expected recovery time is about 6 months or more therapy. It takes that long for the graft to incorporate and be back to full strength. The expected results after ACL reconstruction is that over 90% of the patients will be able to return to full activity without restrictions.